The government is spruiking its nearly $15 billion cost of living package announced in Tuesday's budget. It includes energy subsidies, rent assistance, and even a boost to the job seeker rate. But are these measures enough to help those doing it tough? And how is the cost of living crisis affecting everyday Australians? Joining us live now is the Shadow Assistant Minister for Mental Health and Suicide Prevention, McIntosh. Melissa, thank you for your time. Firstly, can I get your take on Labor's budget handed down on Tuesday? Does it go far enough to help everyday Australians?
Thanks very much for having me on. This budget has forgotten the people of Western Sydney, those families that are working so hard to get ahead, both parents working, commuting out of the area for work, high mortgage costs, high energy costs, high petrol costs. In no way, shape or form does Labor's budget address the severe cost of living pressures that people in my community and right across Western Sydney are experiencing. I met with some charities just the other day who look after people experiencing homelessness, and they told me that their meals that go out every week have doubled, so from 2,000 to over 4,000 meals. And they aren't people experiencing homelessness that are lining up for the meals. They are families with two incomes. They are small business owners. We are crying out for help in Western Sydney, and this budget does not address these cries.
So how does the Coalition's budget reply really address those concerns?
The Coalition does support some of the measures in the budget, but as Peter Dutton said yesterday, it has forgotten the working poor, people that are just really working hard to get ahead. It also doesn't address the mental health crisis that we are experiencing in this country. We have been through multiple disasters. We have been through COVID. We are now going through a cost of living crisis. And at this very time, Labor decided to halve the psychology sessions that are available to people through Medicare. So I was really pleased that Peter Dutton and the Coalition are listening. We're listening to the mental health sector. We're listening to people pleading for those psychology sessions to be returned. We're listening to the 40,000 young people who have signed a petition asking the government to return these sessions. And Peter Dutton announced last night that a returned Coalition government would return the sessions, increase them from 10 back up to 20 to help address this mental health crisis.
So what about increasing job seeker by $40 a fortnight? Is that something you'd support?
I think Peter is right in addressing, and I go out to businesses all the time who say to me, we have jobs available. We just cannot fill those jobs. These are small businesses in manufacturing, across in cafes. I went to a cafe down the road from my office the other day, and they said we cannot fill these jobs. So I absolutely agree with the opposition leader, Peter Dutton, in that we should be implementing some form of work for these payments to help enable people to get back into the workforce, because right now they are small businesses out there, and I met with them just the other day who are telling me they are about to close, and it's these small business owners that are lining up to get meals from people who usually service people who are experiencing homelessness. The alarm could not be ringing louder. They just need people to be ensuring that these people in Western Sydney, the government needs to be addressing this, and I'm getting really worked up about this because we're not addressing the mental health crisis and we're not addressing the cost of living crisis that people are facing in my community and right across Western Sydney.
Okay, we're tight on time, so I do want to speak to you about long COVID as well. You're the Deputy Chair of a parliamentary committee that this week released a report into long COVID. One of the recommendations was to establish a COVID database. How would that help?
One of the biggest problems we have in this country when it comes to COVID and long COVID is we just don't have the information. We don't have the data on how many people are suffering with long COVID. And this can range from quite mild symptoms, which is what I had after having COVID, breathlessness, some fatigue, to really severe symptoms where people are extremely sick, they've lost their jobs, they can't even get out of bed. So the very first recommendation is to establish a database. We made a number of recommendations to the government. It's really disappointing. Our report was released just last week and we tabled it in Parliament this week that the government hasn't put any of those recommendations in the budget. So it's very well and good to have a great report, to have the very first inquiry of its kind into long COVID in this country. But once again, we need the government to be taking this really seriously. We've found linkages between COVID and some really serious diseases like type 1 diabetes. We need more investment in research. We need more investment in long COVID clinics. We need more investment in the care and diagnosis of people who are experiencing long COVID in Australia.
Shadow Assistant Minister for Mental Health, Melissa McIntosh, thanks so much for your time. We have to leave it there.
Thanks very much.